Hello.
Hi.
So I'm student nurse Megan,
And I'm student nurse Brandy.
and we're going to be demonstrating our bed bath and occupied bed making.
Okay.
At this point, we would have washed our hands and put clean gloves on, so now we're going to address our patient.
Hello. I am student nurse Brandy.
And I'm student nurse Megan. Can you please confirm your name and date of birth for me?
Now sit back here.
All right, Miss Lonnie. Today we're going to be giving you a bed bath, and then we're going to change your linens after, okay?
Is that all right with you? Okay.
I'm going to go ahead and draw your chart for privacy.
Sandwich it again.
All right, and we're gonna
Sandwich it one more time.
We're going to raise your bed
That's how you gonna do it.
so that we don't hurt our backs.
get that at like hip level. And then I'm gonna go ahead and lower the rail.
Alright, Miss Lonnie, so first we're going to take your top blanket down
And
set it off to the side.
so you can roll it towards me.
Yeah, here you go.
And I'm gonna put this in the dirty linens basket.
Or no, we're just setting it off to the side.
Okay.
It's fine.
Okay. Okay, and then we're gonna go ahead and tie the bed bath blanket on me.
So finishing the staff.
Alright, next Miss Lonnie, we are going to help untie your gown and remove your
Finish
sheet.
the staff on the side.
So we're just gonna go ahead and lift you up a little bit, get your I'm going to go ahead and take removing your sheet underneath as well as your gown. Keep you covered.
This should have been still on her. She had a gown and
Alright, and then these will go in the dirty linen basket.
on down with her gown. Somebody grab a chair. That's what we do.
Alright, now Miss Lonnie, we're going to give you a towel for some extra privacy. And we're going to start by washing your face.
So we have a
Okay, we'll put that chair back over there.
So it's best to fold it into thirds and then tuck it in so you have a nice flat surface. And when we start with your face, Miss Lonnie, we're going to start from the inner portion of your eye, moving out, and then we're going to wash the rest of your face, okay?
You gotta get off. Because your hair got it. So just move that over.
And Miss Lonnie, we're taking your hand.
So both can have access to
We're going to lower this a little bit just to grab your neck area.
Okay.
Great, Miss Lonnie.
Now we're going to switch cloths. First, you're going to adjust your blanket.
Alright. This, like I said, should have
So we're going to clean your arms first,
everything
Miss
should have
Lonnie.
been taken from under.
So if I could
Not this.
take your arm out while
Actually, this was
student nurse Brandy gets my towel ready.
hold it.
I'm just going to set this towel underneath your arm just for a little bit of a barrier.
Clean. That's considered clean.
So new washcloth,
See another bedspread? No.
fold it into thirds.
This is when you got to that point where you
Miss
got
Lonnie, I'm going to start with the tips of your fingers.
like you had this up coming down.
Make sure I get those nails.
Going down, down.
Nice, smooth strokes. And then I'm going to flip my washcloth,
And what was your question? I didn't skip to something totally everything.
and I'm going to clean the palm of her hands, starting again from the tips of her fingers.
No. It should be a third person. If you could grab somebody and have the video, y'all both gonna be.
And then I'm going to get another washcloth to clean her axillary area.
And she can do her part on the front part. And the pair.
And then I'm going to dispose of this and change my gloves, sanitize.
So they can see that you.
And Miss Lonnie, we're going to switch your arms out.
Go ahead and grab this.
Right. Now after every
And then I'll hand this over to Nurse Megan.
This.
And I'm going to go ahead and lift your arm for you. And we're going to replace
Sanitize my hands.
this.
Put on my plate.
There you go. Alright. Kind of don a new cloth.
I mean, doing your changing out the clothes.
You're gonna feel so refreshed, Miss Lonnie.
Yeah, and just making sure we have a flat surface to work with. And I'm going to start at the distal area with the fingertips. Okay, just going in straight motions, making sure I'm getting wide range. Alright, now I'm going to get rid of this washcloth. I'm going to flip your arm over, like this. And I'm going to replace my washcloth.
Then you dry it. And then
Again, with a flat surface, we're going to start at the distal area of your fingers, working our way towards the upper portion of your body. Okay. Alright, and I'm going to change my washcloth once again to get the axillary portion.
Head, face to
Another flat surface,
chest.
and I'm just going to wipe
Chest
the inside of the axillary area and remove my washcloth. Okay, I'm going to lift your arm, and I'm going to hand this over to Nurse Megan. Set this down and cover you back up. Alright, so now we are going to do the upper chest area.
So I'm gonna give you a little privacy with this, Miss Lonnie. We're gonna pull the back blanket down.
Revealing the abdomen and the chest area.
Now that we both have a fresh set of gloves and a fresh washcloth,
doesn't matter because you gotta change your gloves anyway.
we can start cleaning Miss Lonnie's
You
abdomen.
gotta change. So if you do this, you change your gloves.
Start at the chest.
This, you don't have to change your gloves.
And use the backs of our hands to rest, clean underneath, down, downward, Alright, Miss Lonnie. So now we're going to change our washcloths.
You have a fresh set of gloves.
We're going to move on to her legs. Alright, Miss Lonnie. You lift your leg a little.
Lifting the leg, we're going to go ahead and place this towel underneath for a barrier.
Alright. Fresh washcloth. And for Miss Lonnie's legs, we're going to start at the ankle. So, long, smooth strokes going up Miss Lonnie's leg. Alright, then Miss Lonnie, I'm going to have you bend your leg for me. And supporting her ankle, I'm going to clean underneath. Then I'm going to get a fresh washcloth. And I'm going to clean Miss Lonnie's feet, starting at her toes. Making sure I'm getting the nails and in between. Top of the foot. Between her toes. Around the heel. And then I will get rid of this, change my gloves, sanitize, and Miss Lonnie, move on to your next leg. Okay? So I'm gonna lift your leg for you.
I'm going to go ahead and lift this blanket over, just revealing the leg. I'm going to go ahead and lift, and we're going to place that for a barrier. Alright. At this point I have clean gloves, so I'm going to go ahead and grab a fresh washcloth. Flat surface, I'm going to go ahead and start at the base of the ankle and move up. In striping motions. I'm going to go ahead and replace with a new washcloth. I'm going to go ahead and lift a little bit at your knee area and start at the base of your ankle, moving my way up your leg. Okay. Your leg back down. I'm going to go ahead and take a new washcloth to do her feet. Alright, starting the top, I'm just going to go ahead and wash the top of her feet, between the top of her toes. Okay, and then I'm going to go ahead and wash in between her toes and all the way down her feet. Okay, and I will remove these gloves and put a fresh set and get rid of this washcloth.
Alright, so we're going to move this towel. And then next, Miss Lonnie, are you comfortable doing your own pericure? Shall we assist you? Need assistance? Okay. Right. So we're going to put this towel across your chest for privacy. Going to pull the bath blanket down. And then, since I have a fresh set of gloves and a fresh washcloth, I'm going to hold the blanket up to try and give her some privacy. I'm going to go from front to back, clean to dirty. I'm going to go ahead and switch out my washcloth just to be sure, so I can finish doing her pericure. Alright, Miss Lonnie. Now we're going to flip her on her side so we can wash her back.
So we're just going to put this towards the side.
So I'm going to lift this rail up. And Miss Lonnie, we're going to turn you towards me. If you can hold onto the rail for support, that would be wonderful. We're going to flip on 3. So 1, 2, 3.
Alright, now that we have split, I have a fresh washcloth here. She's holding on to the rail for some support, and I'm just going to wash her back area in circular motions.
Now, again, let the bed down.
Okay. And now I'm going to wash the buttocks area. Then we'll go ahead and wash the buttocks area. And I'm going to go ahead and change my washcloth. And I'm going to go from front to back, clean to dirty. Okay. Got rid of this washcloth. And we have fresh gloves.
And we're going to lay Miss Lonnie back down. Alright. Great. And now that Miss Lonnie is nice and clean, we're going to get your linen changed.
So we can go ahead and lower the top portion, or do you think it?
Yeah, let's go ahead and lower the top portion.
Yeah, good?
Laying down would be more comfortable. And in fact, we can even raise that a little more.
Just to make it a little bit more comfortable.
Okay, alright. So, to start, we're going to... That's not... Good catch, instead. We're going to dress Miss Lonnie. As long as we catch it, we're good. Miss Lonnie, you were so kind and patient with us.
Okay, we're just going to go ahead and put her right arm in.
Hold over her shoulder.
Put this a little bit higher, and then we're going to go ahead and put her other arm in. Alright, over her shoulder. And we'll just replace this on top.
Making sure she still has her privacy. And then Miss Lonnie, we're going to sit you up.
And we're going to head and tie the back of the gown.
Wonderful. And now we're going to change
perform.
Miss Lonnie's bed linens. So we're going to lay her down flat so it'll be easier on her. All right, so first we need to remove the dirty linen. So
I'm gonna go ahead.
you put the
Okay. So we're gonna lift her this way. Okay. All right.
so the rail.
Oh, the rail.
Yeah. So we're lifting a rail for Miss Lonnie to use as support, and we're going to turn her toward student nurse Brandy. So on 3, Miss Lonnie, okay? 1, 2, 3. Keeping the blanket over her. And from here, I can take off her bottom sheet. We already took her top sheet off with her old gown. We're also removing her old draw sheet. From here, I can replace with the fresh top sheet. Now we're gonna making sure that's nice and secure, and then I'm going to straighten it out and roll it. And then I'm also going to put a fresh draw sheet down. And we'll have the closed side on top, open side on bottom. I'll roll this up as well. All right, Miss Lonnie, we're gonna roll you back on your back now.
1, 2, 3.
And then I'm gonna put this side rail up, and we're gonna have you roll towards me, okay? Okay. So on the count of 3. Is it stuck? All right. On the count of 3, Miss Lonnie. 1, 2, 3. Okay. And try to hold on to this rail.
Hold on underneath you. All right. I'm just gonna go ahead and take off these dirty linens. Roll them together and place this in the dirty linens pile. Okay, and now I'm going to go ahead and place the old sheet with the new sheet. And pull the draw sheet down. Second.
Miss Lonnie, we're going to lay you right on your back now.
Gently lay your back.
All right. And at this point, we have a fresh top sheet for Miss Lonnie.
We're just going to lay this on top of her.
And after she is nice and covered, we can remove the bath blanket, keeping her covered and maintaining privacy.
So I'm going to roll this towards me, and I'm going to go ahead and put this in the dirty linens. All right, we're going to go ahead and tuck the sheet in at the bottom.
Okay. Make sure there's enough room for her feet. And yeah. And next is her comforter.
All right. Place this blanket on top of her top sheet, just for a little extra warmth. And we are going to tuck this in, leaving a little bit of a lip at the bottom as well. Okay, let the rest hang out.
Alright, and we're going to fold the top over so she's nice and comfortable. Alright, and I'm going to tilt the rails back up. Alright,
And make sure at least 3 rails
So what I want you to do
are lifted.
Alright, and then Miss Lonnie, would you like to sit back up? Yes. Alright. Let me raise the head of the bed for you.
I bet you feel better now, huh?
Nice and clean. And then we're going to lower the bed to minimize the risk of falls. Alright, Miss Lonnie, I'm going to help you sit up, and we're actually going to replace your pillowcase too. Do that. Here you go, Miss Lonnie.
Alright.
You don't want to pick up anything.
So I'm going to take off this pillowcase,
Germs flying.
put this in the dirty linens, and replace it with a new pillowcase.
When it's folded like this, pick it up.
Ideally, this should happen before we lower the bed to minimize the strain on our backs.
Don't go out there.
We'll set this back and then lay her head gently on top.
Lovely, Miss Lonnie. Alright.
Alright, so we have gave her a bed bath and we have performed occupied
Bed making.
bed making. Alright, so